Hello, Team Phoenix, and welcome to my YouTube video, Facebook Live, LinkedIn, wherever you're watching me from. It is not easy doing this on a random day of the week, and especially at 10 a.m. That's 1 p.m. Kenyan time. So I know it's not easy, most of you at work, but what motivated me to do this is the fact that tomorrow is World Kidney Day, if you did not know. World Kidney Day is celebrated every second Thursday of the month of March. It is a commemoration of kidney disease, or it is an attempt to raise awareness about kidney failure. And we do this every second Thursday of the month of March. It started in 2016. So why do I care about kidney disease? I care about kidney disease because number one, I am a kidney nurse specialist, if you did not know. So I try my best, or I believe that if people are informed about kidney disease, then definitely they are going to do something about the same. So that is why I do what I do. Above all, I try to use my social media channels to raise awareness about kidney disease. So I put together a very small presentation, a very small presentation, which I will just breeze through, hoping to God that it will make sense to you and you will be in a position to understand why kidney disease is important. So I will share my screen. Yeah. This is what we want. We want this. Yeah. And let's make a start. I'm not sure whether you people can see this screen, and the fact that there's no one to tell me, I am even more conflicted about what I'm sharing. Oh my God. People. Any communication, I would really appreciate to know whether it's making any sense to you. Can you see my screen? I don't think you can. I need to share it again. I was just saying that I wanted to make a quick start, and my reasons for doing this live video is the fact that tomorrow is World Kidney Day, and as such, I will be at work. So I wanted to raise awareness about kidney disease with the hope that you will understand and you will learn something from this a little bit rather short presentation on what kidney disease is and what we can do to raise awareness, and also what is the management of kidney disease. So I'm really trying to upload my slides. Imagine I am trying to upload my slides, and it seems like I am coming across challenges that I had not anticipated. So they are supposed to be here somewhere. Sorry, people. World Kidney Day. Okay, fine. I can't find them. So you know what we're gonna do? I am going to present my screen. So I would really appreciate some feedback if you don't mind. Please let me know. Can you see my screen? Can you see my screen at all? At all? Now you can, isn't it? Now you can? Anyone? Can you see my screen? I really hope you can. Now I can't see you. Okay, it's telling me that the screen is live, and I need to check on my phone to make sure that it is live. My God, Kate, what makes you think you can do this? Yes, I second guess myself all the time. So can you see my screen? Let me follow this link and see. Yes, you can see my screen. Thank you very much. So let's make a head start. So it's World Kidney Day 2024. It's going to be tomorrow, which is the 14th of March, 2024. And for introduction purposes, if you don't know, I am Catherine Maina. I use Kate Mimi as my pen name. I am a United Kingdom kidney nurse specialist. I'm also an American kidney health coach. Let's do this. So just like I have explained to you, we observe World Kidney Day every second Thursday of the month. This is an annual event that started in 2006. It is a joint initiative of some very important bodies that take care of all matters kidney. Number one is the International Society of Nephrology, and we have this other name with a very, very, very long name. So what is the theme this year? It is Kidney Health for All, Advancing Equitable Access to Care and Optimal Medication Practice. Come on, that is just a mouthful. It is quite a mouthful, and I have no idea who came up with such a long name for a theme. But then again, it is quite appropriate because it implies that kidney disease, as it is quite complex, and it is ambiguous if you think about it. Because if I were to ask you, what are the signs and symptoms of kidney disease or kidney failure? If you hear someone has kidney disease, how do they present? I know you're going to tell me a lot of things, and most of them will overlap with, signs and symptoms of other diseases. Let's go back to the basics and ask ourselves, what are the functions of the kidneys? And you will tell me it is to make urine, and you will be right. However, what does urine contain? So urine contains excess water. It also contains any waste products that has been removed from your blood, okay? So the basic function of the kidney, you could think about the kidneys as a sieve. Its work is to filter or to clean the blood, okay? The other one is that our kidneys are very good in balancing the levels of acids and bases in the body. It also helps in the manufacture of red blood cells. You will tell me, but Kate, red blood cells come from the bone marrow, and I will tell you, you are correct. However, for the bone marrows to be able to produce those red blood cells, they need to be told by the kidneys in the form of a hormone called erythropoietin or EPO. This hormone is the one that tells our bone marrows to produce red blood cells. So in essence, what I'm trying to say is that you can get anemia, that is low blood cells or low blood count in the body, if your kidneys have shut down. The other thing that our kidneys help us with is control of blood pressure and regulation of our bone strength. That is because the vitamin D that you get from the sun is in an inactive form. The body cannot use it. It needs to be activated in our kidneys. So I hope you watching this or taking screenshots of this, you realize that the kidneys are quite important. When we talk about kidney disease, we're talking about two types. We have acute kidney disease, which we usually call acute kidney injury. Some people are still calling it acute kidney failure, but it is really the better way of calling it is acute kidney injury. And then we have chronic kidney disease. When we say acute, the word acute is an English word. It means sudden. So if we say sudden, then this disease or this injury of the kidneys will occur suddenly, okay? And the good thing or the good news is it can be reversed. So it occurs suddenly and you can reverse it, meaning that you can heal from it. It does not require kidney transplant. Chronic is also an English word. It means over a period of time. It is something that is continuing. So it will occur slowly. It is over months or even years. And eventually someone needs a kidney transplant. So if we think about the acute one, which we have talked about, we have said it is a sudden one. What are the causes? This is a very busy slide and I will ignore everything that is in there and just talk you through it. So anything, at any point, every minute our heart pumps, about a quarter of the blood goes to the kidneys, okay? And you're talking about both kidneys in this case, right? So what usually happens is if any reason or for any reason at all that blood supply is diminished, then you can get a sudden onset of kidney injury, okay? We're calling it injury because you can heal from the injury, okay? So think about anything that makes you lose blood. What are the examples? Number one, bleeding, severe bleeding conditions. For example, after a mom has delivered, and they get something that we call postpartum hemorrhage, that is severe bleeding after birth. They can end up with injury to their kidneys. Suppose an accident happened, maybe a car accident or whatever it is, and you lost a lot of blood. You can end up with kidney injury. Think about dehydration. Yes, you people who do not drink water, don't you know water is life? We had a lecturer, a tutor back in college who used to come to class and say, water is life. Everybody go and get a water break. And I believe her. Water is life. So you don't drink water, you're so dehydrated, you're injuring your kidneys. Okay. If you have any disease that makes you diarrhea so much, for example, cholera, dysentery, typhoid, these are diseases that can make you lose a lot of, because when you think about blood contains a lot of water. Is that not true? A lot of the huge component of blood is actually water. So if you're diarrheaing, you're losing a lot of water. So what we are trying to say is, if you eliminate the cause of the kidney injury, then you're going to heal. Okay, so you remove the cause, you end up with perfect kidneys. Now, let's think about the chronic one. So we've seen that the treatment for the acute one is just remove the cause. Whatever cause it is, remove it and you will end up with perfect kidneys. But what about the slow one, the chronic one? There are two main causes in any setup in the world. Number one is diabetes. That is the problem of having high or low blood sugar. The other one is high blood pressure, and some people will call it hypertension. But there is something I like about what I do online is I like breaking down complex medical jargon into tiny little bits that everybody can understand. So we call it high blood pressure. Then there are other reasons why someone may get a slow type or an insidious type of kidney disease, and some of them include genetic conditions like polycystic kidney disease. This is a situation where the kidneys form huge, let me call them pimples, very huge pimples form inside the kidneys. So there is no space for any filtration to occur. Okay, it is a genetic condition. Then we have HIV and AIDS. We have severe urinary tract infections. We have some types of cancers. Actually, any cancer that can spread anywhere in the body can cause kidney disease. Then we can have severe obstruction of urine flow. Think about men who develop enlarged prostate glands. Yeah, the obstruction can be so bad